Welcome to the first lesson in our mental health training course for non-specialists, based on depression module of the WHO Mental Health Gap Action Program Intervention Guide. This course is adapted from the World Health Organization's Mental Health Gap Action Program, also known as MHGAP, and contextualized by the Federal Ministry of Health in Nigeria. In this opening lesson, we begin with an overview of mental, neurological, and substance use disorders, commonly referred to as MNS disorders.
These conditions affect millions of people around the world, including in Nigeria and other low and middle-income countries. They are often misunderstood, overlooked, or even feared. But understanding what MNS disorders are is the first step toward better support, better care, and ultimately, better lives. Let's begin with the basics. What exactly are MNS disorders? The term MNS includes three broad categories. First, mental disorders, like depression, anxiety, psychosis, and bipolar disorder. These affect a person's thoughts, emotions, mood, and behavior. Second, neurological disorders, such as epilepsy and dementia. These are conditions that affect the brain, spinal cord, and nerves, often leading to seizures, memory loss, or movement problems. And third, substance use disorders, which include harmful use of alcohol, drugs, or other substances. These disorders not only harm the body and brain, but also relationships, livelihoods, and entire communities. Now, you may be wondering, how common are these disorders? Simple answer is, they are very common. Globally, 1 in 8 people live with a mental health condition. In Nigeria alone, millions of people are affected by depression, anxiety, epilepsy, or substance misuse. Yet many never receive the help they need. Why? Because of stigma, fear, and a lack of access to care. And this is where you come in. As a non-specialist, you can play a powerful role in recognizing symptoms early, offering basic support, and helping people get the care they deserve. Let's take a closer look at the impact of MNS disorders. These conditions can affect every part of a person's life, how they think, feel, work, relate to others, and even how they care for their families. They can lead to poverty, school dropouts, job loss, or abandonment. In some cases, untreated MNS disorders may even result in homelessness, violence, or at worst, even suicide. But here's the important truth. MNS disorders are treatable. People can recover, manage their symptoms, and live full and meaningful lives with the right support. Now, let's pause here and reflect. Have you ever encountered someone, maybe in your community, school, or clinic, who was struggling but misunderstood? Could they have been living with an MNS disorder that was never recognized? These questions matter because when we understand what we're looking for, we're better able to respond with empathy and action. It's also important to understand that MNS disorders are not a personal weakness. They are health conditions influenced by genetics, environment, trauma, stress, poverty, or substance use. And just like other health conditions, they require care, not shame. People with MNS disorders need the same kindness, patience, and access to treatment that we would offer anyone with malaria, asthma, or a broken bone. In this course, you'll learn how to recognize the signs of common MNS disorders, how to offer support that respects people's dignity and culture, and how to refer those in need to the right services at the right time. Because change starts with understanding. To recap, MNS disorders include mental, neurological, and substance use conditions. They are common, treatable, and often misunderstood. With awareness and support, people can recover and live healthy, meaningful lives. You don't need to be a specialist to make a difference. You just need to care, to notice, and to act with compassion. Thank you for being part of this journey toward better mental health for all.
In the next video, we will dive a little deeper, understanding the mental health gap in low middle income countries, or LMICs. Hope to see you there.